Thank you all. And it's time to start the international session. Today is the 1877th day of uninterrupted daily webinar of IFPH. Before beginning the session, let's have a silent. Hello, doctors, students of homeopathy, and friends of homeopathy. Today is the 1877th day of uninterrupted daily webinar of IFPH, and I am Dr. Binduraj, the moderator of this session. Today, our guest speaker is Dr. Prakash Rao, former research officer, Central Council of Research in Homeopathy, Government of India. He do have more than 30 years of experience at the CCRH. Dr. Prakash Rao undertook projects with UNICEF and AIDS Control Society. And today's session is the second part of the session, Infertility, Homeopathy and Research. Let us welcome Dr. Prakash Rao for the session, and I welcome you all for the session.
Yeah, previously also I talked about infertility. Now, can you see my slide sharing, sir?
Yes, sir.
This is infertility causes, challenges, and global issues. Global response. Understanding the fertility care and its importance. First, we will touch the advanced topic that what WHO is saying about infertility. Last time also I have given briefly the what is infertility, the definition of infertility and everything. Now this time we will touch what WHO is saying. Then we will go to female infertility, then male infertility, then the homeopathic medicines that have been proved. What is the mechanism of the action of the medicines, particularly for PCOS. We will show it in fourth part, sir. Now this is the second part. Now what is the WHO saying about infertility? Let us understand. What are the key facts? The WHO says that infertility affects 1 in 6 people of reproductive age worldwide. In worldwide, everywhere, we thought that previously in Germany, because it is cold country, in France, it is a cold country. So the fertility rate, London, the cold country, the Switzerland, cold countries. So the fertility rate is slow and low, but it is not true. Even in hot countries, the infertility patients are present both in sexes, in both genders, male and females. And the infertility rate, even in South Africa, in India, Pakistan, Bangladesh, everywhere. So the rate of infertility is 1 in 6 people of reproductive age throughout the worldwide. There are two conditions, very well you know all these things. Primarily we have to discuss. That is male infertility. The male infertility is because of low sperm count, abnormal morphology, abnormal motility, and ejaculatory problems in male. And the female infertility is ovary, uterus, fallopian tubes, or endocrine abnormalities. Now, key facts. There are two types of infertilities. Primary infertility, that means after, in Indian context, after marriage, there is no pregnancy or there is no pregnancy before marriage in foreign countries. And secondary infertility is at least one prior pregnancy. There will be one pregnancy or abortion. After that, the woman won't conceive again. This is known as second infertility. In primary infertility, what happened? No prior pregnancy are present. Even male and female meet together and live together for about 1 year or above the 1 year of life span or time span. The fertility care often not prioritized in national health coverage. See, usually what happens? We won't give the priority to the infertility cases because in India we have more cancer cases, more COPDs, more surgeries, more diabetes, more hypertension, more stunting. So infertility will be given a second care preference. But nowadays the awareness has created so much that even the infertility centers are floating with the patients. But usually infertility will not be treated as a major cause that will take the life away. So therefore, the importance of infertility is very less among the educated and even uneducated people. So overview of infertility. Failure to what is actually infertility means failure to achieve the pregnancy before 12 on or after 12 months of regular unprotected intercourse. If that is in Indian context, we will call it as marriage. In foreign countries, there is no question of marriage as a law to live together. So if unprotected intercourse is done for about 12 months, and if there are no conceived, if the female is not conceived, it is known as the failure to achieve pregnancy. It is known as primary infertility. Causes may be male or female, I explained. Some causes are preventable. Treatments include most of the causes are preventable with homeopathy. Unfortunately, they haven't did research in homeopathy and they were going with the conventional system of treatment. So most of the problems that can be dealt medically, the treatments include one of the very popular treatment now roaring practice is being done. That is, despite of 1.3 crore population in India, the infertility clinic rates are increasing. The rates of clinics being opened at district headquarters also. That is because the infertility is causing in a couple and it will be known as a social problem. So they are thriving nowadays. One of the treatment option is IVF, medically assisted reproduction. So in this, there are again ethical these conditions which are being involved. Let us discuss later. So causes of female infertility first we go. One is tubal disorders, blocked fallopian tubes, sexually transmitted infections, unsafe abortions, postpartum sepsis, and unnecessary surgeries, which might have caused for PCOC before marriage. There will be surgery that will be applied, or for the fibroid uterus, the incompleted removal of the fibroid uterus, or myometrial surgery, or something that is surgical failure. And uterine disorders, endometriosis, fibroids, septal uterus is very common. Septal uterus usually causes abortion in a pregnant woman, but septal uterus never causes infertility. And ovarian disorders are PCOS and follicular disorders. The endocrine disorders are pituitary, hypothalamus, hormone imbalances. So these are some of the things which you know very well. And male infertility contains obstruction, blocked ejaculatory ducts and seminal vesicles, hormonal disorders, particularly pituitary, testicular concerns affecting testosterone, and testicular failure, varicocele, chemotherapies in cancer patients, impaired sperm production, and there will be another cause where the interstitial cells by birth they never produce the sperm except the hormones are present. That was not given even by WHO. So abnormal sperm functions. See the sperm totality of sperm count or the sperm functions, they are not up to the mark. Morphology, that is the sperm may die before it reaching the ovary. And mortality issues, the motile spermatogenesis count will be less. And anabolic steroid use, excessive steroid use for asthmatic or childhood asthma or some of the infections of the body during the from puberty to the young age, that will decrease the motility of the spermatogenesis. And lifestyle environmental factors, particularly smoking, alcohol, and obesity toxins. Alcohol will have its own problems. In the beginning, alcohol will stimulate the stimulation and it will produces more sexual virility and there will be a tendency to rape women. Naturally, gradually, it will be converted into neuropathy and there will be disorders of impotency in alcoholics, and obesity also produces impotency. Smoking also because of thrombocytic agenitis, because of vein supply, blood supply to the penis and corpus cavernosum muscles will decrease. By that, there will be environmental and lifestyle changes. By that, the male infertility will take place. This is only brief to explain externally. Now, Importance of addressing infertility. What is the importance? Recognized as a human right, health and family planning. Though one side the population is increasing, there is a birthright for a male person to become father, and for female, it is the birthright to become to express their motherhood. That is most important. Motherhood with a liked person. That is known as human rights issue, and that is sentimental and emotional. Impacts of emotional stress, anxiety, depression, and the what happens when a woman is sexually, or if she is not conceiving and infertility, it will become a social stigma. Violence and divorces are very common in India because the first wife has not produced children with her husband. So gender inequality will come, and see, going for second marriages, culturally, socially, it is very common in India, and that will impact. So sexual infertility also create social problems, emotional problems. Education and awareness are the only key. There are no other go except educating women, and male and female together, and creating awareness about the infertility is more important. And infertility, though it is not being treated as a disease, it is a social pandemic problem all over the world, which occupies the second seat of the medical treatment, that will make the doctors do research as well as a very good commercially clinical practice. It also adds to the doctor's economy. Then challenges in fertility care. What are the limited availability and accessibility? What are the difficulties in accepting or attending or addressing the infertility? Are limited availability and accessibility and affordability of the treatment. Usually in the conventional treatment, IVF, intravenous, in vitro fertilization is very tough time, and it costs lots of 3 to 4 lakhs of rupees. A poor person can't be affordable, and the government are not having infertility clinics. So government will not give free of cost the infertility care, because government is not in a position to give the treatment costs, or they are not in a position to give free treatment to a diabetic, to a malignancy patient. So we cannot expect from the government that they will give treatment for infertility people. And in vitro fertilization access inaccessible in our medical care clinics, in the sense, in the suppose we cannot expect a in vitro fertilization in our public health centers, or regional health centers, or small clinics, because it involves the lack of equipment, technology, and money. Lack of trained persons. See, we don't have trained persons for counseling the malignant patient, counseling the diabetic and heart patient, counseling the neurological problems patients. So how we will get a person who will be trained to counsel and to address the person who are suffering from infertility? So the infertility is one of the problem. So the infrastructure is another problem, where the awareness could not be created, where the fertility doctors are available, in which city, where the cheapest treatment will be done, and the high treatment cost. The other problem we have is infertility will cost more than the cost of the heart attack, or stunt passing, or bypass surgery. See, each sitting, if in vitro fertilization is done, it will cost from first sitting, it may not, it may fail. In second sitting, the ovary may not accept. In third sitting, it may click. So for each sitting, it will have around 1.5 lakhs. So for 4 to 5 sitting, approximately, when we have carried out a survey in 10 clinics, the successful ratio is around 70%, and all the patients have told that they spend around 8 to 10 lakhs of rupees to have a child. So high treatment costs, and fertility case rarely prioritized in national health policies. In national health policies, we will find blindness, we will find cancer, malignancies, particularly breast cancers. We will find the vaccination, we will find diabetes, we will find obesity, but the fertility will not be addressed because neither it will be called as a disease nor it is a condition because we have overpopulation, particularly in India, it will not be prioritized and it will not be given an importance and there won't be any awareness or even in radios we won't hear that what causes infertility and who will listen to this program. But there are patients, we can't call them as patients, but there are couples who really wants to have a wanted child in the society and they are being discarded from having the facility from the government side. So these are some of the things in infertility. And this is the first part and limited fertility. Then policy programs. Prevention is focused. Can you see my slide, sir? Policy programs. Prevention is focused on sexually transmitted diseases, diagnosis, treatment, safe abortion, postpartum care, environmental toxin reporting. Fertility awareness education is completely nil, particularly in India, and whatever that is present, the law to regulate third-party reproduction or ART. See, this is also being misused in government when the government allows us to have in vitro fertilization and see the third-party reproduction that is surrogated uterus. These have been misused by Indian people. So ethically, it is becoming very difficult to implement the service and monitoring quality by government. See, so many things are being happened day to day. See, there are so many cases connected with IEF, in vitro fertilization and surrogated mothers in court, and it is bringing litigation. So that is again monitoring, implementation, and service quality is becoming difficult. Then what WHO says? The WHO says research. See, what is the response? Epidemiology, etiology of infertility is not up to the mark. And policy dialogue to create enabling environments. See, we should have policy making guidelines for prevention, diagnosis, treatment of male and female infertility. There are no guidelines so far from the WHO. Even though the guidelines are present, they are not up to the mark. சார் சொல்லிட்டேன் சார் அவர் சொன்னாரு நான் சென்னைக்கு ஃபோன் பண்ணி டோன்ட் வரி அங்க பிளட் நான் ஒரு அரை மணி நேரம் டைம் கொடுங்க எனக்கு நான் ஒரு செமினார்ல இருக்கேன் ஸோ திஸ் இஸ் வேர் த கைட்லைன்ஸ் prevention and diagnosis treatment of male and female infertility is not possible, is not present even in India. The collaboration, academic centers, ministries, UN organizations, the high-level think tank has not taken it as seriously. So many problems, though scientific advancement is present, many ethical problems are coming. The technical support, country-level implementation of fertility services. See, one person who is undergoing some treatment at Delhi, they will not have facility to have treatment in Trichy or treatment in somewhere Kottayam or somewhere in Coimbatore. So there is no connection between infertility clinic. Everybody is acting as their own clinics and scientific institutes. So that is creating a problem for infertility to be addressed at a national level. So these are some of the references. I will attach my second slide. Participants share screen. So this is now today we will deal with the program of female infertility. There are two types of infertilities. So these two infertilities are being addressed by homeopathy. And most of the cases, the 50% of the cases that have been taken intravenous in vitro fertilization as well as homeopathic treatment, and the success rate of homeopathic treatment as well as in vitro fertilization, both are almost equal. And in vitro fertilization is being utilized for obstructions which are beyond the normal level of homeopathic treatment and which are beyond level of hormonal treatment. Sometimes the hormonal treatment also fails, but the homeopathic treatment is not failing, and the success rate is as equal to as IVF, in vitro fertilization. So we have wonderful medicines. Let us first understand the causes and etiology of female infertility. Then we will deal with the male infertility. Then we will study the successful medicines and their pathological action, their mechanism action on PCOS and infertility, and how they work in pathology, in physiology, and how they will make the fertilization. To fertilization is a normal thing. How they will make an infertile woman to make them to a fertile condition. How they will bring. What are the changes we will read in our third part. So endometriosis. This is interference with tubal patency, endometrial fragility. See, the endometrial layer will be very fragile and that will tear at any time. It will grow and it will grow inside from the uterus, the endometrium, myometrium, and ectoderm. From there, it will reach to the intestines and it grows. And the homeopathic medicine is highly successful for endometriosis. And these adhesions that displaces the ovaries. So what happens? These adhesions means they will be folded. The endometrium of the uterus will be folded into many things, many layers, and those layers will penetrate from endometrium to myometrium, from outside of the uterus. Your uterus will bulge and it will attach adhesions to the intestines and the colon, upper descending colon and descending colon. It will attach, and such type of infective disorder, it will be considered as the pre-cancer state also. So such states can be reverted by homeopathic medicines. Then treatments. What are the treatments? The laparoscopic treatment, cautery treatment, in the sense they will make the uterus introducing a cautery, and hormonal RX is very common in conventional medicine. Apart from this, one could have added homeopathic treatment which can reverse the endometriosis. So the endometriosis and murex, what is the action of murex on endometriosis? We will see in our third part. Then tubal blockage. What is the tubal blockage? The tubal blockage is scarring pelvic infective disorders, which will be known as pelvic infective disorders. The tubes will be totally blocked. There will be scarring. When the ovary passes through the tube, and that ovary will die. See, usually what happens in birth control programs, they used to previously introduce female birth control. See how temporarily controlling means they used to pass a dye. The threads will enter into ovaries. So when the threads will enter into tubes. When the ovary passes through tubes, if it have any foreign particle, the ovary will die on the spot. That was the temporary birth control that used to be known as T, because it used to take a T shape. Now that tubal blockage will come from scarring. That is, in pelvic infection disorders, what happens? The infection will make the inside the tubes or ovarian tubes, they will have a scar like healed injuries. From over the healed injuries, the ovary will pass once in 28 days, once in 4 weeks. So while passing, if the ovary perceives that there is a foreign particle, or if there is something infection present in the tubes, ovarian tubes, it will die immediately. So there will be infertility. And fibroid uterus, when the ovary that will pass through the ovarian tubes and ovary matures, when it comes to the uterus, if there are fibroids, small fibroids present in the uterus, it will pass through the uterus and fertility will not take place. The spermatozoa also, once it will go to inside the uterus, when they touch the fibroid uterus, they confuse between ovary and fibroid uterus. They will stay for 24 hours to 48. Usually the maximum time is 72 hours. Within that 72 hours, the ovary will not reach the sperm and there won't be any fertility in women. So again, the uterine problems, there will be fibroids, there will be tumors. Those tumors will have a passage control, a block that will not allow the motility of the sperm smoothly. And once the sperm passes over the tumor to the nearby fallopian tubes, by the time it will die, so there will be again either abortion or excess bleeding from the tumor or the stoppage of menstruation and death of the death of the spermatozoa that will lead to infertility and congenital anomalies. The usually in congenital anomalies there will be a small uterus in the female. There is infantile uterus, unborn uterus. There will be ovaries present. The menstrual cycle also comes. The ovary will be stimulated, and the ovary comes to the uterus, but the uterus will be in infantile style, or the size and growth of the uterus will be very small, where the ovary can't come out of the uterus. The another congenital abnormality is tightness of the mouth of the uterus, where we will call it as see when we see the elasticity of the mouth of uterus will not allow the ovaries to come, and there won't be any bleeding, and there won't be any recognition of the cervix will be always tight, and there won't be any understanding of the menstrual cycle whether it is coming or not. But the women will have all the second sexually characters, but the uterus size will be very low, very small. So that are the congenital abnormalities. And anovulation. What is this anovulation? Is absence of ovulation where an ovary does not release an egg during the menstrual period. In congenital abnormalities, usually during the menstrual periods, when the estrogen, progesterone in equal and follicle stimulating hormone, when they are equally being secreted in the body, when the posterior pituitary gives the message, the ovulation will take place. But the ovary will not have an ovary. It only gives down the hormones and the blood, and that will not contain the ovary that will takes fertility. There won't be any egg present in that. The yolk of the ovary will not have egg. Like in hen egg, where we will see there will be yellow part, there will be a white part. In the same fashion, in the ovaries, there will be a missing egg. That egg will not be present, only menstrual cycle will be present, and the bleeding will be normal. And without egg, there will be an ovary, and that ovary, a dumped ovary, an empty ovary that will not fertilize without presence of egg. So egg is most important, and this is monoovulation, where the congenital abnormalities, the uterus will be small, normal in size. The ovaries will be normal in size. The fallopian tubes are also normal. The every month menstrual periods are regular, and the hormonal levels also normal. And despite all these things, the fertility won't take place because the ovary will not contain the egg. Until and unless we will see the ovarian matter under microscope, pathologically when we investigate, then only the diagnosis will take place. Usually such cases are many present in India. Even if you see around 50 years of age who were not conceived, they used to have the menstrual cycles. Their partner, the male partner, will have normal spermatozoa count, motility rate will be normal, and no doctor was in a position to diagnose. Nowadays, the absence of egg, there are various diagnosis kits have come. The absence of egg has been found out. This is known as anovulation. Now, this treatment is available only in big cities where we can identify the anovulation is present or egg is present in the ovary or not. And these studies can take place, and homeopathy can offer a fantastic treatment for producing the ovary, like in male, where the interstitial cells of the testis won't produce the sperm. There will be seminal ejaculation, there will be seminal fluid, there will be prostate fluid, but there won't be any sperms in the seminal ejaculation. In the same fashion, for an ovary also, there won't be any ovary, dead ovary or live ovary that will be presented, or egg that will be presented in the ovary of the woman. This has to be pathologically diagnosed. This can make it difficult to get pregnant. and is often linked to hormonal imbalances or underlying conditions like PCOS. The PCOS also will make the ovary not to have eggs, and hormonal conditions, particularly lutein stimulating hormone, excess progesterone. Excess progesterone will make the ovary not to have egg. So hormonal imbalances is a little tough task with homeopathy, but PCOS is very common to be treated with homeopathy. Recently, we got a case of excess progesterone that is being secreted. So female will have all female characters except fertility. So nowadays the awareness has been created to decrease the progesterone. There are no medicines and only a treatment beating around the bush. Even in the hormonal treatment, there is beating around the bush is present, and it is a tough task even to homeopathy to control. So progesterone increase and PCOS can be controlled with homeopathy, and infections in the fallopian tubes can be controlled with homeopathy. That I will discuss in my third part. Then genetic etiology. What is genetic Turner syndrome? Turner syndrome is where there will be a moon phase. The patient will have obesity, hypogonadism, and vaginal muscles will be highly protruded. And for seeing, they look as if they are sexually being highly attractive, but their romantic feelings will be absolutely nil, and they will not have any sensation of romantic feeling or to have sexual intercourse. This is a genetic problem in women, and this will be very tough to address. And these are some of the limitations where homeopathy and allopathy. The only thing is, allopathic doctors won't tell that they can't do anything, whereas homeopathy doctors will tell, and they will be going on making them some surgeries, some of the new investigations, the research methodology they will practice on the patient. If one success comes, patient will be going on behind them, but there is no evidence-based surgeries or any successful treatment for hypogonadism in women. Problems with hypothalamus. See, the pituitary and ovarian hormone. There will be feedback mechanism. The pituitary will tell that 4 weeks are over. Once the ovary is matured, you kindly release the ovary from fallopian tubes or in between fallopian tubes and near uterus. The sperm is waiting for you. So these pituitary signals will not be present in women. This mechanism is very difficult to understand. This is a hypothalamus mechanism where the sympathetic and parasympathetic nerves will come. The pituitary gland and the ovaries will not work hand in hand together. So there will be a feedback signaling mechanism will be disrupted. This is very difficult to find out. And no, see, the signals means we have to keep a patient for about 28 days and the signal stimulation is coming, the neurodiagnosis and everything, even after diagnosing, making the hypothalamus to listen to the pituitary gland and making the pituitary gland to give instructions to ovaries and making the ovaries to secrete the egg and let it be released through fallopian tubes. Tough mechanism, but this problem will be present only in 0.5% of the women, and every woman will not suffer with these problems. But 1.1% of the women will suffer with lack of egg with ovaries, and 0.5 over 5. That means out of 1,000 patients, one woman will have this problem, and it is very difficult. The third is hypothyroidism. The hypothyroidism will make a woman first obese, so it buries the ovaries. When the ovaries are buried, the egg present in the ovaries will be killed, and that egg will be released, and the menstrual cycles will be delayed or early. Sometimes they are early. The other hormones will be normal, but the hypothyroidism will create an obesity problem. Particularly, the obesity will take place at the abdominal area inside the fatty layer. The deep fascia, the superficial fascia will increase, and that will come here the momentum. Particularly the deep fascia. The deep fascia will cover the ovaries, and that ovaries will be buried anatomically. And when the ovaries are buried, the egg will not be released. The egg will be killed. Rather, it will be stuffed, and hypothyroidism produces. The hypothyroidism also plays a role where the bleeding will be very less and the ovary will not. So controlling hypothyroidism is most important. Stress is another factor where stress will increase the hypertension. That hypertension will reduce ACTH. That ACTH will produce the growth hormone. That growth hormone will again increases the hypertension. So that stress during the young age can be managed. So it will have greater impact over the menstrual cycle, and that menstrual cycle will be irregular, and the ovary that comes from the fallopian tubes because of severe stress, by the time it reaches the uterus or end of the fallopian tubes, it will die. Though the spermatozoa present is in numbers, plenty in numbers, they will not have the tendency to fertilize because the ovary will skip and it will burst open because of stress, and the bleeding, the egg that is present in the ovary will die because of stress, and that will create lot of problems. Then there are two problems for women. One is excessive body weight. See, excessive body weight because of hypothyroidism and decreased body weight. See, very thin women, it is very difficult to have fertility because the size and shape of the uterus will be very common, very normal. But at the same time, the thinness of the body will make the pressure over the uterus, particularly the anal region. So that will press the uterus. The spermatozoa as well as ovary will be concussed. They are pressed in the uterus, and very thin woman who looks like a girl or who is very below the 38, 35 kilos of weight, it will be very difficult. Even the women with tuberculosis also will not conceive. So it will be again a problem. That's why women should wait the normal BMI, normal weight. At the same time, they should not be obese. These are some of the women's problems. And the annovulation, what is the treatment? See, we will first discuss the conventional treatment. Then we will come to why conventional treatment I am discussing means. Number one, a homeopathic doctor will have. We have to compete with allopathic doctors in the society. Then we have to compare ourselves with the allopathic doctors. We have to treat the infertility cases on par with the allopathic doctors' technology, and the financial burden on the patient should be very less. And we have to understand the etiology. We have to understand the treatment pathology, treatment prognosis. Sometimes we also need the help of the allopathic doctors in treating them with homeopathy and with allopathy, hormones as well as homeopathic treatment. This is known as integrated approach of the treatment. If they give progesterone hormone, if they decrease the progesterone hormone, we can make the ovary to grow in a normal size, and we can give medicine to grow the uterus into normal size. We can decrease the PCOS. They can give hormonal medicine. So that integrated approach also works very well. That's why for a homeopathic doctor, there will be a burden of working so much. They have to do homework, that they have to understand the allopathic treatment aspects. What are the medications they have been being given, and what are the supplements medication that homeopathy can be given side by side. It is not mixopathy, but if we understand so much of the endocrinology and hormones, see hormones, endocrinology, endocrinal disorders will come under the disease classification of the Hahnemann as the disease that they are incurable, as well as they are psychosomatic and they are psychic, psoriatic, all three miasmatic combined disorders. So to approach the miasmatic combined disorders, where we need the help of the suppression, where we need the help of the palliation by allopathic medicine, at the same time homeopathic medicine to combat and to treat pathology. Sometimes what happens in endocrinal disorders, homeopathy work very well on pathology better than allopathic medicine. For the endometriosis and murex, I will show you the mechanism of action in my third part of infertility and PCOS. So the treatment anovulation, where the ovary will not have egg, and that what are virginal, Repronex, medications that are made from gonadotropins to extract from the urine of the postmenopausal women. See, urine therapy, everybody will blame. but that is not a blame, where the urine will be utilized for the treatment. This secret nobody tells. Either they will make jokes of the urine therapy or they will use urine at inappropriate time. And but this will be known to scientists. Even if scientist tells and if so scientifically if he explain that urine will help us in relieving infertility, nobody believes. In the post-menopausal women's urine, see, this is that is not see what they used to practice is auto urine therapy. But here, a post-menopausal urine will be collected. From that, the gonadotrophins will be extracted, and those gonadotrophins will be given to a woman who is infertile. So the urine, why they will be collected from urine? Because these proteins cannot be prepared in laboratory, and it is very becoming, and it is also cheap to prepare these proteins from postmenopausal women. In postmenopausal women, what happens? The gonadotropins will be secreted excessively. The uterus will wean, and the uteral will atrophy, and the excessive gonadotropins can be collected and they can be injected into a woman. See, this is where the urine therapy will be available. Some of the places where urine also can be drunk or urine, see, some of the animals, they will smell the urine and they also will drink the urine. This may be the cause which we do not know. Then is angionist, the synthetic version of gonadotropic hormones. This synthetic version is not working. So the first methodology is post-menopausal women. Abstraction of gonadotrophins is very easy, and that urine treatment is very effective, collecting the gonadotrophins from post-menopausal women's urine. And the anno-evaluation, what is another etiology, is genetics. What is the anno-evaluation? Where egg will not be present in ovary is Turner syndrome, hypogonadism. Problems with hypothalamus, I already told. Pituitary ovarian hormonal feedback mechanism will not be present. Hypothyroidism and state. Decreasing the body weight. And these also the post this also I discussed. And cervical mucus problems. What is the cervical mucus problem? The vaginal infections. The vaginal infections are very common in cervical mucus. The cervical mucus, if the cervix is not properly managed, there is cervical cancer possibility is present. If the woman is not conceived for about 35 years, there will be increase of the cervical problems and the hormone deficiency will come. So a woman best age to conceive is 25 to 35 years of age. As early as women must conceive, it creates a social, financial, economic, and medical burden if a woman being married very late and the hormonal deficiency will come that will retrospectively affect the fetus and that fetus growth will be very difficult again to manage. He will have the siblings will have particularly mental retardation and autism or some of the disease conditions, mongolism, cretinism. These conditions will takes place with the vaginal infections. And treatment is hormone replacement therapy, cryosurgeries, and diaphenesin. Diaphenesin means it is a medicine that will be given. Hormonal replacement also will be done, but they don't have any particular specific evidence which can convert the cervical mucus problems, vaginal infections, hormone deficiencies. Their efficacy rate is lesser than even homeopathic efficacy rate. Let us think of homeopathic. This is today's we discussed in toto all the problems of women infertility. Next time we will talk about female male infertility as well as we will finish the particularly murex, sinisfiga, holocin, calcarea car and other mechanisms, other medicines mechanism of action over the infertilities. So by this it is 9:15. I would like to have a discussion with you because our studies, in vitro studies are going on with Sinisfuga as well as with Murex. So after it will end within another 10 days to 15 days, then we will come out with mechanism of action of Murex over the ovaries and particularly endometriosis and mechanism of action of sinusifuga over the menstrual cycle and premenstrual syndrome, colocin, and PCOS, particularly sepia, natrium, palestilla, what we call as female remedies, what is their role over the PCOS, and how PCOS will come apart from these regular, what we call the common medicines. We also studied some of the rare medicine, the uforbinum, the whatever we call sarcodes. These sarcodes are proteins. When we give sarcodes through mouth, they will fail and they never act as the hormones that will act in human body. Usually, I will give you one of the examples for this. Insulin will not act over the diabetic patient because the insulin is a protein. When the protein is being swallowed, it will be hurt and it will be antagonized by the saliva. The antigens produced by saliva will kill the protein that is present in the mouth and in homeopathic globules, so it will be found as ineffective. In the same fashion, usually the tatopathic or the sarcodes which have been prepared in homeopathy, usually the doctors will use the tatopathic medicines and the sarcodes, hyraidinum, insulinum, uforbinum, gonadotropins, testosterone, estrogen. Why they are not effective like allopathic medicines? Because the proteins that are synthesized proteins that are present in these, when they are potentized, they will be taken as protein. Like snake venom, when we drink snake venom, if we don't have any ulcers in the mouth, ulcers in the stomach, that protein will be easily absorbed and digested. No harmful effects will be present. The liver will produce excess bile juice and it will minimize the action of the proteins of the snake venom, and the snake venom will come out in the form of albumin through urine and from fecal matter. But if there are ulcers present in the mouth, it will enter into the over the ulcers into the bloodstream and it will produce neurotoxic action. In the same fashion, the homeopathy, tatopathic medicines and sarcodes, they are being failed because we are copying the hormones and we want to give. They will work only in low potency when the quantity of the drug is present in the medicine. Suppose uforbinum. In the same fashion, many people have tested the antibiotics, tetracycline, penicillin notatum. Why they won't work means they are all proteins. So, in the same fashion, as well as PCOS and infertility are concerned, they are the proteins that are present in uforbinum, in estrogenum, progesteronum, testosterone, luteinizing hormone, and all these hormones will not be effective until and unless they will be taken in mother tincture form. The banning of these hormones in mother tincture form has taken place, and we will not get the mother tinctures of insulin, arsenic, sulfur, conium maculatum, because they are as dreadful as the original poisons. So we get only in 3x. 3x means again 1 is to 10 is to 10 is to 10. So there won't be any poisonous effect. When the poisonous effect is not present in quantity of the medicine, the homeopathic similia similibus studenta rule will not be followed. The efficacy won't take place. That's why the over enthusiasm of the proving the medicines without understanding the pharmacokinetics of the medicine has led homeopathy also to have false criticism. This is the reason why homeopathy being criticized by everybody, because it will see the pharmacokinetics are something different and the pharmacological action is something different. Clinical proving is something different. See, estrogenum never works like estrogen that is present in allopathy. It because it is a hormone. The hormones imbalance in homeopathy, if you take according to organon, it will needs another discussion and it needs other meeting to discuss about the hormonal action, because they will not have any impact homeopathically. The similia similibus cure it cannot be applied to the hormones because the hormones are only physiological deficiencies, and these physiological deficiencies cannot overcome with similia similibus currenter theory. That's why we will fail with the sarcodes that are present in homeopathy. But some of the sarcodes which are not actually the particularly you see a medicine like salival secretion that will act in a different way. In the same fashion, a medicine like gonadotropin will act in a different way. The whatever they think and prove, those provings are not to be successful, but they work in a different way and different pathology. They produce a different symptom. So this is the homeopathic pharmacokinetics as well as the hormones are concerned. Now, I have another 10 minutes time. Now let us have a discussion with you people, and we are carrying out in vitro studies that will end within 10 days. You can have discussion. I request Manoj and everybody, whoever is present here, Bindu Raji, Sir Sridharan Kurup, sir, you are also present. Sir, good evening. You can have a discussion, and let us have in our session, next session, the mechanism of action of homeopathic medicines and PCOS and male and female infertility. So, sir, I will finish my topic by this, and there are 8 minutes left. We will have a discussion.
So I welcome Dr. T.N. Sridhar Group for the discussion.
Sir, I just joined that. Will you please tell me the subject here? I think that is approving.
Yeah, yes, sir. Next session, sir.
Yes.
Next session, we are coming with Murex and mechanism of action of Murex in clinical provings, and that too mechanism of action, sir, where CCRH also may not be knowing, where we have done here, the Murex and endometriosis.
I don't know. They gave that code number. More than 10 medicines proved in CRIH Kottayam.
Yeah.
During my tenure, but we don't know the.
Share with us.
Okay. We don't know the medicine's name, but we have done it very accurately in the along with the Homeopathic Medical College of Kottayam, Kurichi.
Yes, sir.
It was very successful, accurately followed. And for 6 months, I was the coordinator in headquarters.
Yes, sir.
Okay, but I couldn't take all the details from there. I came to Bombay. I was in all the I lost because in the 2018 there was a flood. Within that, my record went out. That is why, sorry, I was not able to tell anything now. Okay, thank you very much. Anyway, I know that you will not be very good person by taking classes and all these things. Thank you very much.
Thank you, Doctor.
Okay.
Hari Narayan Prasad Saab. Ram Pravesh Shah Saab. Hello. Sir. Safiq ji.
Let me welcome Dr. Ram Pravesh Shah.
Thank you, sir. Bindu Raji, and
Namaskar.
congratulations, Dr. M. Prakash Rao, sir. Very
Sir,
nice, excellent session. Very good. Describe the infertility case under so very nice. You have many kinds of multiple remedy.
Yes, sir.
And according to law of CCRH medicine. So very thanks, sir. Thank you.
Thank you, sir.
Thank you.
Namaskar.
Namaskar.
Thank you, Dr. Ram Pravesh Shah. So the homeopathic treatment is far better than IVF treatment. That is the thing you incorporated in this session. With research analysis, you are just pointing out all these things, and we do have a lot of information like gonadotrophins of postmenopausal women's urine. They are using in treatment. Allopathic persons, they are using in treatment, and things. Definitely, it's great thing. And the tautopathic medicines, why it's not working? Why it's not giving good results when it is in the potential form? These are all things which we get from your session. And here, Dr. Dhanesh is with us. Let us welcome Dr. Dhanesh.
Dhanesh, sir. Good evening, sir.
Thank you, Dr. Bindraj.
I would like to have discussion with you people that will be very helpful for me in my research.
Yes, sir. It was really an
Your
excellent
feedback
session.
is very good.
Both the
So
two sessions
the
were
second
really
session is over, sir. In third session, we will show the mechanism of action of homeopathic medicines, particularly endometriosis and murex, sir,
yes,
and
sir.
PCOS and the success rate. Then
Yes, sir.
the reasons for infertility from the male side we haven't discussed it in detail. The next time we will, in our third part, we will discuss, sir. I am
Yes, sir.
very happy that being Deepavali also around 29 to 30 people have attended the seminar.
Yes,
And
sir. Yes,
more
sir.
than Hindi seminar. I have seen Hindi seminar. There were 22 attendants and today we are 29. I am
Yes,
very
sir.
much thankful for your
Yes, sir. Yes, sir. Yes, sir. Please wait, sir.
yes.
Sir, both your sessions were excellent about this infertility and the research. And really, homeopathy has done a lot of work for these things. We have doctors who are having more than 2,000 successful cases in their kitty. There are many doctors in Kerala because and even in our government hospitals, we have 300 successful cases of infertility where there in Koilon district alone. We have 14 districts in Kerala, and almost all these districts have such excellent results. We have there are a lot of reports from different part of Kerala from these district homeopathic medical hospitals. And even some 3 years back, there was more than 800 successful cases were presented from Kannur alone. So that means that Kerala homeopathy is doing excellent work in this field, and not only in private practices, as we all know that nobody is coming towards homeopath in the beginning of their problems, but they may visit a gynecologist and they may change the gynecologist from one after another. They may change the hospital from after. They may take different type of treatment, including IVU and all those things. But even after that, when they get failure, they may approach a homeopath, and where we can do excellent job. Even we have seen that just even after 5 years of infertility, a patient was telling the reporter that they got result within 6 months. They even though they failed 2 times in IUV. So that means
You
that
are correct, sir.
we
The
need to
success, you are 100% correct, sir, Dr. Danesh, sir. The success rate of treating infertility with homeopathic medicines and with in vitro fertilization. That means that is the costlier treatment that is available by the gynecologist are equal, sir. And in vitro fertilization, even after wasting so much of money, in the first sitting, the success rate is only 10%, sir. And the rest of all, the suppose 100 cases have been treated with in vitro fertilization, the 10% of the cases are only getting success with the first sitting. And they are going for second sitting, third sitting, fourth sitting. Each sitting will cost about 1.5 lakhs of rupees. And around spending 8 lakhs rupees, they will have a wanted child. Whereas a homeopathic treatment with single doses for treatment about 6 months to 1 year and 3 months to 6 months have got the success. And homeopathic treatment for female infertility is better and 1% to 2% better than IVF. That has been proved. That's why the homeopathic clinics, particularly in Kerala, the homeopathic doctors are in a position to treat successfully. And your observation is 100% correct. Next time
Yes,
I
sir.
will show you the mechanism of action. Why
Yes, sir.
homeopathy is
Yes, sir. The Department of Homeopathy in Kerala will definitely do a research on that, and they will publish the result also, so
Yes.
that the new the world will look at Kerala for not only for Kerala but towards homeopathy in this uh,
You are right,
tragic
sir. Correct, sir.
tragedy.
Thank you.
Your observation is 100%
Very
right.
exciting
Yes.
session, and we are expecting the third session because
Yes, sir.
we will be having lot of medicines, the approaches, and everything. We are waiting for you
Yes, sir.
in the third session, and it's time to conclude, and it's time to start the Malayalam session. And on behalf of IFPH, I thank Dr. Prakash Rao for.
Thank you very much. Thank you very much, sir. Good night, sir.
Thank
Sir,
you. Thank you.
Ram
Thank you all
Prasad,
for attending this session.
Ganesh sir,
Thank you.
and Prup sir, and Binduraj sir. Thank you very much. I will take leave. We will discuss more scientific part, and what is the mechanism of action is the most scientific part of homeopathy, where we will tackle and we will compete with allopathic doctors in scientific field, not professionally, or we don't have any antagonism against allopathic doctors. But we also definitely will not allow them to say that homeopathy is unscientific. So that is our motto. Thank you very much, sir. Thank you. I will take
Thank
leave.
you for the motivation. Thank you. Thank you for the guidance.
Sir, thank you.
Over to Dr. Shaila for the Malayalam session.